Okay, I have an interest in some complementary therapies, John, because
Yep.
one of them in particular, Reiki, has had a huge positive effect on me and still does. And I know that mental health organizations generally say or believe that there should be a range of complementary therapies available for users of mental health services. But John, in Ireland, we are a long way from seeing this happen, aren't we? Or,
Certainly in Ireland, the model of service that we see on the ground is primarily what's called a medical psychiatric model, and it's dominated by the profession of psychiatry, which is obviously part of medicine, and it's strongly influenced by nursing practices. We do have other disciplines such as psychology, social work, occupational therapy, and so on, but by and large, some of these, many of those posts are not filled. And this is the problem behind the community mental health teams, that they don't have the full complement of staff. I know individuals use complementary medicines. All sorts of people for all sorts of ailments will use complementary medicines. By and large, and hopefully they're all safe. I don't know enough about them myself directly to comment on that. But people do use things like Reiki, like mindfulness, like relaxation, like yoga, and so on, to help them to deal with not only the physical but also the mental anxieties and worries that they have. I think that's all pretty good, and I know that many services may well introduce some of these as options for people, but they're certainly not part of the core service. I think that's because we still have a very medicalized service which insists that the only way of approaching severe mental illness is to deal with it through a medical psychiatric model. The Vision for Change policy and the most recent version of that, sharing the vision, is very clear that it's not just about psychiatry, it's about a whole range of disciplines providing a multidisciplinary approach.